the life running in your veins. This dead flesh needs it.
Oh, please spare me, Dark Queen. Spare your obedient slave.
Finally, you've returned.
Yes,
you've
duty.
many.
I'm all right.
Good evening. I'm Dr. Reed. Can I help at all?
No,
Really?
I don't want to talk. My throat hurts too much.
I suppose that this pain is the reason you're here. Is someone taking care of you?
Yes,
Could you at least tell me your name, sir?
Mortimer. Mortimer Goswick.
How painful is your throat, Mr. Goswick?
So painful I'd rather not talk at all, Doctor.
I'm sure you realize a doctor and his patient have to communicate, sir. Would it help if I gave you some paper and a pen?
Not really.
I see. Then maybe it's not just your throat that hurts, Mr. Goswick. Perhaps your sore throat is just the consequence of something more hurtful.
Yes, maybe. But I don't want to talk or even write about it now.
How painful.
So painful I'd...
Tell me about yourself, Mr. Goswick.
I don't want to talk.
Do you need any help?
I'm afraid I may, sir. I don't mean to be a burden.
You are not a burden, sir. Healing you is my responsibility.
And you have my gratitude.
Do you need any help? Do you need any...
Thank you, Dr. Reed, but you've done enough already.
How painful.
So painful.
I'll let you get some rest, then.
Good evening, sir.
Good evening, Mr.
I'm okay.
Do you need any help?
Thank you, Dr. Reed, but you've done...
I have to go now.
Good evening, sir. Doctor.
Good evening, madam. Can I help you?
It's my son who needs you, sir.
I'm Dr. Jonathan Reed. How can I help your son?
I'm Beatrice Goswick, mother of Mortimer Goswick. Could you check on him, please, Dr. Reed? I've heard much of your talents as a physician.
What can you tell me about yourself, Mrs.
Not much to say. Just take care of my Mortimer and I'll cover all the expenses.
May I ask if you have an occupation?
I'm a teacher by profession. I teach young women who are more ambitious about their futures than their families.
Good evening,
Doctor. Are you really that rich?
Yes, thanks to my husband. May he rest in peace. I can cover any needed medical expenses.
Do you require medical attention as well?
I have other concerns, right?
What do you think of your reception here?
I have had the uttermost reservations about this hospital since we arrived. But we had no other choice, considering the state of emergency.
Is there something in particular that's bothering you?
Some of the staff were not especially welcoming. I suspect they're not accustomed to dealing with patients of such social standing.
What do you think? Is there some
of the...
What can you tell me about yourself?
Not much to say.
Tell me more about your arrival at the Pembroke Hospital. What gave you such a bad first impression?
The ambulance driver was quite rude, for a start. And that nurse, Miss Hawkins, seems to have quite a dubious attitude.
What do you mean?
She managed to secure a bed for my son despite the epidemic. It was a relief, but it wasn't cheap.
She charged you For a bed?
Yes, and I paid without question, considering the urgency of this.
I share your concern, Mrs. Goswick. Be sure that I'll talk to the people involved.
I don't expect compensation, Dr. Reed. But I'm aware such behavior would not be tolerated in other hospitals.
Goodbye, Mrs. Goswick.
Reads me like a book.
Good evening, Mr.
I'm okay.
Why did your mother have you hospitalized here? She seems convinced this is a bad hospital.
My mother just wants the best for me. She won't rest while I...
Pembroke Hospital may look unorthodox, but rest assured you're in good hands here.
It's not me you have to convince, Dr. Reed.
Is your mother bothering you? As your doctor, I can ask her to leave you alone if you would prefer.
That's tempting, Doctor. But you have no idea what my mother is capable of. She would tie herself to my bed if you asked her to leave.
I have to go now, sir.
I'm all right. Don't waste your time with me.
Good evening, Doctor.
My sweet girl.
Do you require medical attention?
I have
Goodbye, Mrs.
I will not let you down, my boy.
Good evening, sir. Doctor.
You always knew the words to calm the children, Ellen.
Dr. Reed, may I have...
Well, Dr. Swansea certainly has confidence in your ability.
Not in an official capacity, but the Pembroke doesn't always work above board, so to speak.
What about medical protocols?
Dr. Reed, we don't have the money and resources here at the Pembroke like they do in the West End. We do what we can.
How is the duty roster organized?
Everybody works until they can't. If there's time, they'll eat a meal and shed a silent tear.
I will not let you down, my
For how long have you been working here, Nurse Crane?
I first volunteered at the Pembroke in 1911, a few months after Dr. Swansea was appointed.
And before you arrived here?
If you must know, this was my first job.
What can you tell me about the epidemic, Nurse Crane? I've been out of touch since I've come back to England.
Everyday folk don't know how bad it is. The papers certainly won't help.
News on the front stated that the Spanish flu was under control, at least in Britain.
It seemed to be for a while, but that was only last summer. It returned with a vengeance just over a month ago.
What can you tell me about our patients here at Pembroke?
This hospital was founded to help the East End poor and needy. But since the war and the quarantine, we've had all manner of folk.
Can you be more specific?
Well, veterans, the elderly, dock workers. We even have a few mental patients. If there's space, we take them.
I'll see you later,
Dr. Reed.
I'll see you later. Good evening, Doctor. I believe we're going to be Dr. Reed.
Dr. Swansea informed us of your arrival, but I could not dare to believe we'd have such good fortune. Such an honor, sir.
Thank you.
I am Thoreau Strickland, Dr. Thoreau Strickland. I'm a great admirer of your work, Dr. Reed.
Please, could you tell me something about...
I'm a great admirer of your work concerning blood transfusion, Dr. Reed. I run my own experiments. I'm convinced it's the future.
What made you choose to be a doctor?
I'm not ashamed to admit you and your work have inspired me. I am honored to have the opportunity to work by your side.
It's always a pleasure to share scientific and medical knowledge with someone eager to learn. I'll be glad to help you if I can.
This epidemic may be the century's most terrible disaster, but I'm convinced that we, as doctors, are the only ones
I based my technique on my mentor's research. He helped me perfect my method. What is yours?
I'd rather not talk about it. For now, it's just theories and first approach. My process is purely experimental and unsuccessful.
As long as you're cautious and methodical, you may remain empty-handed, but you won't fail.
You're not the first one to warn me, but I am convinced knowledge is the main weapon against the ravages of this epidemic.
What can you tell me about...
Well, it has always been an honor to work with Dr. Swansea, but with your arrival, I can't think of a better opportunity to learn about blood transfusion.
Do you need help with anything in particular?
Well, yes, maybe. I'm waiting for a batch of products I ordered for my personal research, yet my supplier seems to have vanished.
Do you want me to play the errand boy for you?
Oh no, Dr. Reed. But if you went personally to his shop, what with your reputation and all, he wouldn't dare to refuse the products I need.
I see. Well, give me the address, for I may pass by if I have time. You seem quite optimistic. It's a rare and precious attitude in these difficult times.
I'm convinced that this epidemic is a test of endurance and dedication for us men of science.
Questions remain about our capacity to resolve the situation.
True. Last summer, during the first wave of the epidemic, I used to joke with Milton about the extra work. We're not smiling now.
Do you need my medical attention?
You don't have to worry about me, Dr. Reed. I am here to...
Tell me more about your willingness to experiment with new medical techniques.
Harvey Fiddick is a patient suffering from a severe injury that could cripple him if not treated correctly. I'm convinced your blood transfusion technique could help him.
What is it you really want? To save...
Fair question. I want nothing but to save my patient, Dr. Reed. Especially since I know Mr. Fiddick's story.
This personal involvement could also appear to be a lack of impartiality. You must know that a good surgeon must remain neutral.
I agree. But that does not excuse Dr. Ackroyd's behavior, a man who did not even take time to converse with his patient.
Do you think keeping his distance was a mistake?
All I know is that I'm taking care of human beings with desires.
Tell me Mr. Fiddick's story.
Our first diagnosis was compromised because Mr. Fiddick lied to us about the real origin of his injury. He first claimed it was an accident.
But why would he hide such crucial information from us?
Because he is a proud father, ashamed of putting his children at risk because of his own negligence.
Goodbye, Dr. Strickland. Good evening, sir. I'm Dr. Reed. I believe we're going to be colleagues.
Reed, yes, I've been informed about your arrival. I'm Waverly Ackroyd.
Welcome aboard, I suppose.
Does my arrival inconvenience you in some way, Dr. Ackroyd?
Let us just say that I don't particularly share Dr. Swansea's enthusiasm for hiring you. What we need here are reliable professionals, not overrated dabblers.
If you have a problem with me, Dr. Ackroyd, please feel free to tell me.
Dr. Swansea has imposed your presence on this hospital without asking anyone to...
I know we've never met before, but I believe this hospital could use all the help it can get. You will agree with that, I'm sure.
Oh, but I have heard about you, Dr. Reed. Of course, you can't say the same about me, since I have not wasted my time courting the press.
There is no need for such animosity between us. Don't you think the epidemic is already enough to deal with?
That is one point we could agree on. And that is precisely why I want to be sure that you will be of help to this hospital instead of a...
Since your tenure in this hospital is longer than mine, perhaps you can tell me more about this place.
Let's just say I'm tired of the carelessness around me. I have always respected the skills of Dr. Swansea, but over time his enthusiasm has become...
Carelessness? Exactly.
We're here to save lives. The people who trust us are not volunteering for experimentation, they're here to be healed.
I don't intend to run any radical experiments, Doctor. Even if I, as any good practitioner should, express an interest in pushing the boundaries of medical research.
Modern medical methods were created through audacity and ego. But there are rules in our line of work, and they're here to protect our patients.
Tell me, Waverley, what do you think of Dr. Strickland's enthusiasm for his experimental research?
Strickland is playing with his patients' lives for pride and glory. Now that, sir, is unethical.
Are you thinking about something in particular?
Harvey Fiddick needs delicate surgery. I believe we should stick to the usual procedure, but my young colleague obviously disagrees.
And are you not afraid that your rivalry with Strickland may be blinding you?
Rivalry? I guess you could call it that. But I will never be childish enough to let my personal feelings affect my judgment.
Why do you wish to lead this surgery?
I strongly believe that Mr. Fiddick should not be butchered to test an unproven procedure.
Other people may say that's too conservative a point of view.
Conservative? And what are you going to say to Mr. Fiddick if he loses his arm because of the operation? Because that's what's going to happen if the surgery is a failure.
I don't know what you've heard about me, but I have already proved my value as a practitioner.
I don't question your skills, Dr. Reed, but your motive. Is it money, fame, or are you truly dedicated?
And what exactly is that supposed to mean?
I served in the war just like you. But unlike you, I did not use the wounded to play the modern sorcerer.
Be careful what you insinuate, Dr. Ackroyd.
I only want you to admit you used those men to improve your theories.
Knowledge has always been and will remain our main weapon, and it has always come at a price. And personal initiative.
It is not a question of initiative, it is a question of integrity. These men and women have put their faith in us, Dr. Reed.
It seems you have bad memories of your...
I refuse to see this industrial slaughter as scientific progress. War only reveals the worst in...
We can at least agree on something, Dr. Do you need my assistance?
Not at all. I'm sure that...
Thank you for your time. Good evening, Doctor.
And good evening.
What do you think of Dr. Ackroyd's aversion to modern medical methods?
It's a shame he's so narrow-minded. Dr. Swansea taught me that science is about exploring uncharted territory. I'm convinced that's true.
With the influenza and all that's going on, you should put your differences aside, don't you think? Why is it so difficult to work together?
I believe that if Dr. Ackroyd had been the one to discover the transfusion process, he would be the first to recommend its use.
So you believe it's just a question of jealousy and pride?
Dr. Ackroyd is as proud as he is blinded by his obsolete concept of medical science.
Goodbye, Dr.
I'm quite busy right now.
Thank you for...
How long must I wait, damn it?
Blaming me will not
Dr. Reed,
your agenda, sir. How long did government take to fix me from?
I'll see you later.
You have the right to disapprove of our methods, and
Fear and disgust on every street corner. The daily route.
Hello again, Dr. Reed.
How do you feel?
I feel exhausted.
You're in good hands here.
Thank you.
Goodbye, Miss.
Yeah.
Good evening.
I need blood.
Damn.
I'll leave.
Here again.
Good evening, Miss.
I need...
Do you require...
I have no...
I'll leave you.
I wish I could be sick again. Feel my blood boil with
Good
the
evening.
fever.
How is your...
Oh, it's bliss. I just escaped.
Can I ask you precisely what?
It's the pain, sir. The drugs don't work.
Who is treating you?
Nobody since the old and tired doctor spoke to me. Started to think I was forgotten about. Wouldn't blame you.
You don't seem worried by that.
My face hurts so much more when I smile or cry. I've learned it's easier not to speak. But be assured I'm smiling inside.
Can I do anything?
Nurses gave me a bunch of pills. No effect. Told you. It's like the flames are under my skin, burning away.
Where were you stationed, sir? Did you, sir?
I really don't want to talk.
No offense. I was pushing too much.
You were an officer, weren't you? Then I doubt we fought the same war, sir. No offense.
How close are you to Miss Horcroft? Are you aware that she thinks she is a vampire?
To wait for her next nibble is the best reason to stay here. Every time she approaches my bed, she treats me like something tasty. A normal person.
Aren't you afraid? She may hurt you if the game goes.
She's quite harmless, I can assure you. Her head's broken inside is all. While I'm busted on the outside.
So do you let her bite you? You know that's...
And why not? She's only supping a few drops of me blood. And the pain, it's real for once.
She could decide to bite less willing patients.
Then it's another good reason for me to stay here, Doctor.
You do realize she's mentally disturbed. It's called the Cotard syndrome. She truly believes she's a vampire.
In her madness, she never refers to my scars. And frankly,
Goodbye for now.
Effect on me. But the suffering continues.
the pain.
Good evening, Miss Hunt.
Here again.
Tell me, Thelma, why do you feel so attached to Mr. Elwood? Why him?
I'm not sure, Doctor. I think we have a bond of some sort. We've both suffered so much. He's the only mortal I...
Do you plan to make...
Of course not. How could I inflict my curse on anybody else?
Would you say you and...
No. No, Thomas is a delicate soul. Even though he disguises it. But I am not the woman.
I'll leave.
Time has lost its effect on me. But the suffering continues.
Eve.
Goodbye for now, Mr.
Fear and disgust on every street corner. The daily routine.